Okay, next we're going to do goniometry measurement at the wrist. First we're going to do wrist flexion. We're going to have her sitting with her arm, forearm extended on the table. I've put some padding underneath it just to help a little bit so we can see it a little bit better. We're going to use a smaller goniometer. The fulcrum is going to be just lateral to the triquetrum bone, carpal bone. The stationary arm is going to be in line with the midline of the ulna, using kind of the styloid process or the lateral epicondyle. And then the moving arm is going to be in line with the fifth metacarpal bone. Okay, so so I'm going to go ahead and have you flex. And then the average reading for this is about 80 degrees. And then we can also do extension or hyperextension at the wrist using the same landmarks and the arm position and forearm extended and anatomical palm up position using lateral to the triquetrum. Again, the stationary arm is going to be parallel to the forearm, the ulna, and the moving arm is going to be parallel to the just lateral to the fifth metacarpal bone. So I'm going to have you go ahead and hyperextend the wrist. Again, making sure that these landmarks are in alignment. And again, the average for this is about 70 degrees. Next, we're going to do goniometry measurements for ulnar deviation. We're going to have her in anatomical position with the elbow extended and the palm facing forward. And again, we're going to use a small goniometer. And for this one, the fulcrum is going to be aligned with the capitate bone. The stationary arm is going to be along the midline of the forearm, and then the moving arm is going to be aligned along the fifth metacarpal bone. All right, so once we let's do ulnar deviation. And normal for this is about 30 degrees, so we would have read that from 180 degree mark. Next we're going to do radial deviation in the same motion, the elbow extended and palm facing forward in anatomical position. Fulcrum again is going to be on landmark for the capitate. The stationary arm is going to be along the midline of the forearm, and the moving arm is going to be along the fifth metacarpal bone. So again, let's have her radial deviate. And for this one, it is the average for this one is 20 degrees. Next, we're going to do goniometry measurement of the thumb flexion. First at the metacarpal phalangeal joint. Average for this is 80 degrees. Again, using the small goniometer, we're going to align the fulcrum just lateral to the joint line. The stationary arm is going to be along the metacarpal bone for the thumb, and then stationary arm, and then the moving arm is going to be along the proximal phalanx. Okay, so go ahead and flex. And the average for this is about 60 degrees. Again, this should be in line with the metacarpal, and this one should be along the proximal phalanx. Then we can also do flexion at the interphalangeal joint of the thumb. And for this one, the fulcrum is going to be right at the joint line. Stationary arm is going to be at the proximal phalanx, and the moving arm is going to be at the distal phalanx. So go ahead and flex that one. And the average for this is about 80 degrees. Again, keeping it stationary arm at the proximal phalanx and the moving arm at the distal phalanx. Thank you.